Hello, good evening, everybody, and welcome to this evening's webinar. I'm Fiona from the events team, and it's great to have you along with us tonight. This evening, we are going to be looking at using AI diagnostic aids in practice, and I'd like to say a big thank you to our sponsor, Hello Pearl, for their support in bringing you the session. So moving on to our speaker this evening, we have Nishan Dixit with us. And Nishan, I've just sent you the webcam request there so you can join us on screen. Nishan is a principal and founder of Blue Court Dental based in Harrow in Middlesex, and he'll be sharing with you how he is applying AI in his practice so you can see how it can support you with your diagnosis in yours.
Okay, hi, thanks Fiona and everyone at the BDA and Hello Pearl for hosting me tonight. We have a bit of a fairly packed agenda, which I'll quickly run through first. So today's webinar, the aim is really to cover a bit about Hello Pearl. So how do we apply AI in clinical setting to improve diagnostic accuracy and boost patient trust? Secondly, we'll also see how AI contributes data that supports your diagnosis and proves your treatment case. And lastly, we'll learn how to communicate AI-supported decisions in a way that reinforces your clinical expertise and strengthens patient understanding. So let me just introduce myself a little bit, tell you a bit about myself. I'm a general practitioner with a special interest in minimally invasive aesthetic dentistry. I qualified in 1994 from Guy's Dental Hospital and worked in VT in Northwest London in one practice and stayed there for 5 years and joined another practice within Northwest London. Around about 2000, so April 2000, I started my own practice, Blue Court Dental in Harrow. Initially, it was a single-handed practice. Then my wife joined me and I expanded it a few years later to accommodate 2 further surgeries. For the best part of 10 years, I was involved with a group called the AOG, the Anglo-Asian Odontological Group, where I was membership secretary and education director. Thereafter, I became involved with the BACD, the British Academy of Cosmetic Dentistry, initially as a committee member, and then moved on to the board as scientific director, where I pretty much organized the conferences and all the educational content for the academy over that time. In 2019, I became the president, and then for 1 year. Currently, I'm working with the GDP advisory group for Align Tech Invisalign. That's me on a day-to-day basis. So let's get into this. So what is AI? Artificial intelligence is simply a set of algorithms that work together to accomplish goals set by humans. Computer scientists train these algorithms by feeding them troves of data, a process known as machine learning. The algorithms learn to recognize patterns in information, which ultimately allows the AI to accurately categorize and make predictions about how we show it. AI has been used in medicine for some time to detect abnormalities in brain, heart, lung scans. It's been done with speed and precision. So why can't we have it in dentistry? Why haven't we been using it? This is where Hello Pearl comes along. It's been passed by the FDA, and its focus is on real-time radiographic interpretation, and it's used globally in many practices globally. Sorry. So how did the X-ray revolution start? For me, it started with just traditional film using X-ray processors. Ironically, when I bought the practice in 2000, the previous dentist had a dark room. Yeah, I know it's a bit scary, but he was literally manually processing X-rays, and that was in 2000. In 2012, we went digital, and in 2024, we started using AI to supplement the digital technology. So these figures were given to me by Pearl, and so we look at the patient's perspective of their ideas of what X-rays and their diagnosis and what they understand. And from this, they basically decided, or not decided, they found out that 65% of patients don't understand their X-rays, which is kind of understandable. Everything's black and white, and we're just looking at a few shadows here and there. Of those, 59% don't trust their X-ray diagnosis at all. They're just trusting what you say, and those that believe you will, and those that don't will say that you're making things up. And then 78% of those say they trust in the diagnosis is key to accepting treatment. You know, at the end of the day, caries doesn't hurt, and if it doesn't hurt, why are we drilling? So X-rays, everything is black and white, but you know, sometimes things look better in color, I feel. And this is where we come to Hello Pearl. So it's goodbye to the grayscale and Hello Pearl. So how did I really get involved with Hello Pearl? And a few years ago, I was at a Chicago midwinter meeting, and I first saw this software, very intrigued by it, what it could do. Consequently, I had a few demos from this company and from other companies, and we kind of went with Pearl. I just liked the whole package that they were providing. I believe that we're a progressive practice, and we like to keep improving our patient journey and the experience for our patients. We also want to set ourselves apart from others, so we decided to take Hello Pearl on board, and we've had it now for a year, and patients absolutely really love it and really value that we've invested in them as well as the practice. So why diagnostics matter? So even the experienced clinician doesn't always agree. So across, if you take a group of 20, 30, 40 dentists, they will all have, you know, there'll be a variation of what they see and what they don't see on X-rays. And that percentage can vary as high as 40% across dentists reviewing the same X-ray. This impacts treatment planning, the case acceptance, and ultimately patient outcomes. This is where I feel AI can really help. It brings in more consistency to our diagnostic baseline, reduces the error, and hopefully for the better for the patients. How does Hello Pearl work? So Hello Pearl basically analyzes the dental X-rays. It takes it straight from your practice management program, your practice imaging program, detects multiple pathologies from caries, calculus, etc. And then it overlays the findings on the image, offering real-time second opinion without disrupting our clinical workflow. Multiple things are detected, you know, like I said earlier, bone loss, caries, calculus, periopical radiolucencies, and it really is very good for them to understand what they're seeing. As I mentioned already, the things that Pearl can detect. Interesting as well, the crowns, the marginal issues of crowns, and restorations, really, especially when they're not your own, it's very good to highlight. So this just really a snapshot of one of the X-rays. It just shows a few things here, just the caries that it detects, the rate of progression, so it gives it as a percentage of how much of it is into enamel, into dentine, and, you know, do we need to intervene or not? And you can explain that to your patient. So we have here Again, another synopsis of what Pearl can show. This is the original X-ray in black and white, and then we start putting it through Pearl, and it shows us the presence of calculus. It will show us the notable margins, so the overhanging deficiencies. It will give you a percentage of the bone loss. Really helps patients understand what's going on in their mouth. Here we got the X-ray showing a little pink lesion. It basically shows the early caries lesions. And again, we don't need to intervene on these, but it makes patients responsible for their own mouth and takes ownership of what's going on in their own mouth. Really, obviously, bone losses again. Periodical radiolucencies are highlighted, and just why we need to do certain treatments. We can explain it better through colour. This is so like any technology, Pearl updates itself or regularly, and now the latest update is really good. On bite wings, we see figures as amount of bone loss, which we have, but now we distinguish between caries, which is pink, and it's interdentine, and early caries is now yellow on the software, so the patients can really understand clearly that pink we may need to intervene, yellow we definitely don't need to intervene at this very moment, and they are aware that there's other possibilities of lesions that may occur later on in their life. So Pearl is clinician-led but AI supported, as I say. Hello Pearl is not about replacing the clinician. You're still the decision maker in this process. AI simply provides a set of second eyes. It's consistent, it's tireless, and it's trained on a massive data set. It enhances your judgment, especially on those borderline cases. So how will Hello Pearl transform your practice? Shows it in a number of ways. Really, we have, firstly, improved diagnostic accuracy, consistency and reduced human error, enhanced workflow efficiency, cost-effective long-term investment, enhanced patient trust and satisfaction, scalability, future-proofing your practice, better compliance and documentation, increased patient confidence, trust, and time efficiency. So I'll have a look at these in a little bit more detail and go through them one by one. We start with increased diagnostic accuracy. AI software can analyze X-ray images with incredible precision. The accuracy rate is probably what Pearl is saying, about 98%. And in my practice, I think that's pretty close to correct. It detects early caries, bone levels, as I said, helps patients understand their mouth. It really works with me. I like the word co-diagnosis. It helps them understand and helps us explain things to them. Really what happens is you show them a lesion with early caries, you go through all the diet and all the other necessary protocols that you may need to do, and really most of the time their answer to me is, Doc, what can I do about it? How can I prevent this from getting worse? What are the things that steps needed to do for me to make sure I don't need anything, another fill-in, etc. So you're identifying details, like we said, that the human eye sometimes misses, and we all miss early caries in a hurry. We've got a busy day, a busy list, and we're glancing through patients, especially when they're recall patients and we've seen them on a regular basis. And sometimes they do develop early lesions. This kind of all encompasses in, I think, a better patient outcome. And it enhances the prevention side of your practice. consistency and reduced human error. By showing them how much caries is interdenting, they understand really why treatment is necessary. So when you have a lesion that's 100% into enamel and not interdenting, we know that we don't need to treat it, and the patients can understand. And then you show them another lesion where it's probably 20–30% interdenting, maybe even more, and they clearly understand why action needs to be taken. And then they also understand that you are monitoring other areas that are possible potentials for future treatment. So the evaluations are pretty much consistent every time. The early lesions, you can take x-rays at the necessary intervals, and you can overlay them and see how much progression has done. As long as you're consistent with your x-rays, the Pearl will be consistent with its findings. It reduces the chances of misdiagnosis, false positives or misinterpretations, leading to more reliable results. But you also have to go back. It's really just a second opinion. So you're always going to go back and recheck those lesions clinically or in any other way if you have other sort of technology like on the iTero, the NIRI, etc. The enhanced workflow efficiency reduces the times required to manually review an X-ray, speeding up the process of diagnosis while spending more time focusing on patient care. Streamlining this process improves productivity and allows you to manage higher patient volume without sacrificing quality. Really, what I touched on earlier is about sometimes we do scan X-rays and we think things are okay, but what this does it will scan it for you and it will highlight areas that you need to have to come back to look at. On this case, it's like an overhanging fill in there that we may have missed out on a clinical examination, recurrent caries, or areas of calculus that the patients, that we've missed out on an X-ray, and the patients need to come back for more hygiene, need more attention in those areas. Cost-effective long-term investment. Expenses related to misdiagnosis or delayed treatments are reduced. Early detection of dental issues prevents them from escalating to more complex, costly treatments. This, I feel, is very important, especially when we've got early care or caries that we've missed, and then that progresses very rapidly into becoming bigger lesions, bigger restorations, maybe costable coverage, maybe root canals involved. Sometimes you can detect, in this case, there's a periapical radiolucency on a virgin tooth, and there may well be associated with a crack. And I can't remember this case, but I think it was a new patient that had some issues, and we after the hygiene that needed doing, we kind of had to investigate the need of a crack. But all those things that came up on an incidental finding on an X-ray, and we wouldn't have seen this necessarily without taking the X-rays. And Pearl enabled us to highlight those areas very rapidly. The enhanced patient trust and satisfaction. Patients increasingly expect high-tech, cutting-edge solutions in healthcare. Using AI shows that your practice is committed to providing top-tier care. Patients appreciate the precision and the speed of AI software, which builds trust and improves satisfaction. They are seeing more of the AI, more of this tech is available for them to see on various social media networks, Google platforms, etc. They know that technology is around, and they do expect their dentist to encompass the technology. And once you do provide them with the technology, they do feel that you're investing in them as well. They appreciate that you're putting everything back into the care of their dental health care. Scalability. This is kind of a bit more appropriate to multiple practices and having a bit more consistency throughout all the clinicians within the practices. It's ideally, for expanding practices that want to maintain efficiency and high quality care as patients' numbers increase. The software can handle increased amounts of data and patient volume without requiring additional staff. And it's really just consistency, especially if patients are seeing different dentists, sometimes happens in multiple practices. There's a lot more consistency about the care that's being delivered and the treatment plans that are being proposed. Future-proofing. I believe AI is the future of dental care. As the tech advances, early adopters will be in a better position to integrate new features and technologies that further improve practice performance. I think you're preparing, by adopting it now, you're preparing your practice for up and coming innovations, staying competitive in the market. And it's really just encompassing the technology that's there, embracing it really. Patient confidence. Patients are becoming more tech savvy and expect advanced cutting edge care. The new practices that are being that are coming up, squat practices, they all have to invest heavily in the design, the technology to attract new patients. The existing practices need to really copy them in a way or follow their lead and bring technology to their patients as well. Patients will feel more assured knowing that AI is helping to ensure accuracy and the quality of their treatment. And interestingly, 71% will trust the dentist diagnosis if it's backed up by AI. In essence, that you see the caries, you see the lesions, the AI sees the lesions, the patients feel reassured that you and the computer are on the same wavelength or on the same page. Better compliance. So AI helps ensure that diagnostic processes comply with the industry standards and legal requirements. Keeps detailed records of its findings, reducing the burden of manual documentation while ensuring accuracy. Also with compliance, I'll explain this just really on the patient's front, what's going on with their mouth on one of the case studies that I've got to show a bit later on in the presentation. So how does all this technology benefit in practice? It translates into faster, more accurate diagnosis, improved treatment planning, and a greater patient trust. When patients see their dentist and the AI aligning, they feel reassured. It builds confidence in the recommended treatment care that's being proposed. It is obviously streamlined, and the accuracy, like I said, is improved, diagnostic accuracy. So these figures were taken, given to us by Pearl on the survey. They looked at 1,000 US patients, and they came up with these stats. So 63% of patients are uncertain if their dentist is reading the X-rays accurately. 55% would feel more confident if another dentist verified their X-rays. And 82% preferred that their dentist use most advanced AI and diagnostic technology available. If it's there, we should be using it. That's what they feel. And that's pretty much, 80% of patients want you to use it. Looking at these figures and how it translated further. So they took these figures and they realized that by using Hello Pearl in the US, 22% increase in general dentistry and 29% in specialty dentistry referrals to other specialties. But looking at the individual treatments, I would, looking at the routine fill-ins, 46% increase in restorations and 12% increase in hygiene treatments. 24% of implants, more implants are done. Root canal treatments, almost 20%. And then you've got big restorative treatments like crowns as well. Big increase in that. Patients can suddenly see a lot more on their x-ray. They understand a lot more from their x-rays. And it does lead to an increase in production. And ultimately, our bottom line has increased in an ethical way as well. But reality was that I've been using this for a while, and I saw all these figures, and I kind of really needed to understand how it works in my practice, and is it worth it? What's going on? And so I decided to do my own little audit. I took 145 x-rays during a 3-month period of between October and January, and analysed them to just analyse them to what was found and what was missed. So these were the results that we found. So there were 44 early carious lesions were detected, of which 32 were initially missed by the dentist, but was caught by Pearl. So these 32, obviously, you know, of these, the 12 that were, only 12 were noticed by the dentist in questions. So you look at it, there's a lot of early lesions that we were missing. Obviously, none of these needed treatment, but it's still a fair number. The outshot or the outcome of this was that there was an increase in sales of fluoridated mouthwashes and floss and other oral hygiene products, plus hygiene treatments. More hygiene treatments were booked. When we looked further, there were 9 lesions that were missed completely, and they needed reassessment and restoration. So there was 9 additional restorations that we would have missed that could have led to bigger treatments for the patients, possibly bigger consequences later on. So invaluable in that respect. So this is my patient journey. How do I use Pearl in my everyday practice? We obviously start with a general clinical examination, as we all do. We all know how to do that. I will then take an iTero scan, where I also use the NIRI technology, that's near infrared technology, to highlight any areas of concern. We will do clinical photographs, intraoral photos as needed, and then we take x-rays. From the x-rays, we put it through, Pearl grabs it, and then we can sit down and discuss the lesions. So when I was talking to this about this technology to other colleagues, there was a few simple questions that came up fairly repeatedly, and I thought I'd just put them in now, and rather than have you ask the same things, really. So how do I explain AI to patients in simple terms? What I usually say is, this software gives me a second opinion on your x-rays. It helps double check what I see, so we don't really miss anything. There are areas once I've taken an x-ray and I see lesions that I may not have diagnosed initially, I will go back and double check them to verify whether they do need intervention or don't need intervention. Is Pearl AI, Hello Pearl, is this hard to integrate into your daily workflow? No, not at all, really. Hello Pearl integrates with your existing imaging systems, as I've mentioned. We use CareStream, and it displays it in real time. It runs in the background, it doesn't slow you down, it's cloud-based, and no special hardware is needed. You do have that. It just literally is fairly seamless. You know, as long as your internet connections are great, there's no real issue with it. So let me just move on to a case study. This let me just, sorry. So this case study, this is a young patient, 30-year-old male called Dylan. Dylan was recommended to me by a friend for some Invisalign treatment. He'd recently been to another practice a couple of months prior to this, had some x-rays. These are the x-rays from that practice. And he had an issue with his lower left 6. It was repeatedly fractured over a 6-month period, repaired a couple of times. He kept saying it just doesn't feel right. The practice that he was visiting basically said there's nothing wrong, gave him a quick clean and said try some Sensodyne. His issues were with hot and cold as well, and he was left to just use Sensodyne. So he sought an opinion from me as well. We did his examination, so his medical history was clear. Intraorally, extraorally, nothing abnormal was detected. So we moved on to the dental aspect, and he only had the one restoration, the lower left 6, and you could see that it was breaking down from this x-ray. And at that point, we'd requested these x-rays, which took us a couple of days to get. Unfortunately, the digital quality, I feel, was quite poor. You can kind of make out a couple of lesions there already in the premolar, upper premolar areas. So basically what we did was we went through this with him and we put it into Hello Pearl. So suddenly we saw a few more things, and we went through this with him, explained that obviously there's a deficiency. You can see the box, the Hello Pearl is diagnosed, and you can see it clinically that there is clearly a deficiency in there. Some other lesions that are present, some are interdentine, some are not, and some are more of a case of monitoring. There's some bit of calculus present in some areas, so he needed a bit more hygiene. We needed to do some restorations. Looking at in a bit more detail again, you can see it in colour, and this obviously impressed him that he could just see a lot of different things. He knew there was something going on here, and we eventually treated him, restored him where it was necessary, and that's the OPG. You can just see that Pearl can grab it, OPGs as well, and bring it into there, and you can just see quite clearly what it highlights. The nerves and any lesions that are picked up. So we can basically say, let me just go back. So with him, we restored him fully. We actually finished him his Invisalign. He's currently just about finishing his whitening, and he's really happy, and he's all symptom free, and recommended a few more other patients, thankfully. So bearing in mind that we've had a few common questions that keep coming up, so I thought I'd really go through some of these as well. So can AI really see what a trained dentist might see? Yes, especially when it comes to subtle or early findings, as I've mentioned earlier on. I think that's, for me, that is the real key, that in a practice that's heavily based on prevention, these early findings are really cool, really good for the patients to understand what's going on. Second opinion has been trained on millions of radiographs and act like a second set of eyes. It doesn't replace your expertise, but it adds another layer of assurance for the patient. You've got to always remember that you're in charge. You are the dentist, you are the clinician, and ultimately the buck stops with you. You have to decide whether you need to treat that patient or not treat that patient based on what you see on the x-rays and what you see clinically. What if I disagree with AI's suggestion? So like I said, you're in control. it's a diagnostic aid which you have to decide whether you accept or override its decision. You have to use your clinical judgment. And there are times when you'll see a lesion and you won't be 100% sure, so you don't intervene. You come back to it. The beauty is that with Pearl is that you can, revisit it with a set of X-rays in 6 months, a year, and whenever that time frame may be, and you can overlay it and see if there's any progress, and then you may want to intervene then. And I think that's what's really good about for the patients. When it's marginally into dentine, you don't necessarily want to intervene straight away, or you may do. It depends on your on the patient and the clinical situation. The interesting thing is on this X-ray, you soon learn to look at X-rays from Hello Pearl, and you realise that there's a bit of pattern recognition. So once you see a certain pattern, you'll know it's disease related, and certain patterns like wear facets show as decay, which may not be decay in the mouth. So again, the more you use Pearl, the more you realize how it works and what lesions need to be looked at again, and what areas are just purely wear facets, etc., or erosion areas. So that's the more you use it, like any bit of technology, there is a slight learning curve, but once you cross that barrier, you're good to go. Really, it's very good. So in summary, there's a few things really. One is when we qualify, we're told you can't treat what you can't see. So we're told to get some loops. Now I feel you can't treat what you can't diagnose. Hello Pearl helps you with this, and there's an ever more reason to look at having an adjunct to your technology in the practice. So my key takeaway is that Hello Pearl enhances and doesn't replace clinical care. It provides a second opinion to your clinical diagnosis. It improves the accuracy, the clarity, and ultimately the case acceptance. And it really gives patients more ownership of what's going on, and it's that co-diagnosis which is critical. And definitely the more routine dentistry is being booked in terms of hygiene. More products are being sold in terms of oral hygiene products. I think they're here to stay, definitely. Thank you for listening. I hope that gave you a brief insight into Hello Pearl, how I use it, and the benefits of Hello Pearl in practice. And